Hi, everyone. Good evening. Thank you for spending your evening with us today. I'm Dr. Josette Dawkins. I'm a fertility specialist at Boston IVF, and I'll be answering some questions for you on this Facebook Live. And we have a few questions popping in. First question is, do you need both ovaries to get pregnant? So you actually don't need both ovaries to get pregnant. There are multiple patients walking around perfectly um, happy with their family with one ovary. And so, depending on your actual diagnosis or your fertility goals, I would recommend that you speak with your provider and just figure out what's the next best step for you. Next question. Do the Boston IVF docs ever work together? I would say yes. And so I'm based in Springfield. I work with Dr. Delaney. Essentially, we see patients independently, but we do collaborate. We do go to the OR together. And so it's similar for most of the practices, most of the offices in Boston IVF. Right. What is a good prenatal for PCOS? Very good question. And so, when we think about prenatal vitamins, the vitamin industry isn't very well regulated, and essentially, you could order a vitamin or you could purchase a vitamin, and what's on the label is not necessarily what you're receiving. And so, these are the things to keep in mind. Number one, you want to make sure that you get adequate folate or folic acid. You want to also ensure that you're getting sufficient vitamin D. Um, For patients with PCOS, there are other formulations out there. So you could look into some that have myo-inositol as an option. I strongly recommend the brand Theralogics, not because I don't have any shares in this company or anything, but in terms of quality, it's third party tested. And so what's on the label is actually what you're getting. And if you have a provider at Boston IVF, feel free to reach out to them so that they could provide you with a referral code so you could receive a discount. And so I would say to answer that question, any prenatal that would have folic acid and vitamin D, and you could consider adding in some myo-inositol as well. Next question is, when is PGT a good idea? So PGT stands for pre-implantation genetic testing, and there are several types that we perform for patients. The most common one that you would come across is PGT-A for aneuploidy. And typically, we offer that test for patients who have either had recurrent pregnancy loss or if they're over 35 because of just the risk of having more embryos that could be abnormal. And in doing this genetic testing, it helps us to select the best embryo that will result in a live birth. There are other types of PGT. So, for instance, if you and your partner are carriers for cystic fibrosis, for instance, and you're trying to avoid having a baby that has a genetic condition, um, you could go ahead and we could go ahead and order PGT depending on your individual needs, as well as there is another type of PGT for if the chromosomes are not arranged in the usual pattern, what we call a translocation, then it makes it challenging for when the eggs or the sperm, when they try to come together, that the DNA is going to be completely balanced in that embryo. And so we could actually do another PGTSR to identify the embryo that is going to be balanced or would result in a live birth. Most people would consider PGTA because that's the commonest one that we do, however. Um, how can you naturally boost fertility? So to naturally boost fertility, um, I would say there are things that you can do and things that you can avoid. And it's going to look a little bit different for men and for women. And here's why. Women are born with the person with the eggs, they're born with the eggs, and there are no more eggs that are created or formed during the lifespan. And so it's very important to protect these eggs because they're very sensitive to anything that could cause oxidative stress. So, for instance, you want to avoid anything such as smoking. That's very, sperm and eggs are very sensitive to smoking, and that's best to be avoided. Also, excessive amounts of alcohol. So perhaps just one drink for a female, which is actually about 5 ounces of wine or one beer, 1 12 ounce. Um, those are things to avoid, as well as anything else such as um, like poor quality food, so foods high in saturated fat, refined carbohydrates, things like that that would promote a lot of oxidative stress. You could do other things such as exercising, maintaining a healthy weight or BMI for your specific body type, as well as ensuring that you take high amounts of antioxidants within a safe limit, so vitamin C, vitamin E, things like that, and also ensuring that you get sufficient rest and taking a prenatal vitamin. Other things to avoid include excessive amounts of caffeine, because that has been shown to also decrease fertility. Next question is, what kind of educational or supplementary resources does Boston IVF offer to people who are just starting treatment? So in addition to our nurses providing information over the portal, we do have information available on our website, as well as we do share information through the portal in person, as well as we do partner with some fertility groups that we could actually refer you to the videos online so you could watch those videos. And then a lot of our data is also freely available online as well. Um, Next question. I've had 4 miscarriages before the second trimester. It's been 6 months since my last one. Is there still hope for me naturally if all tests are normal? Um, I'm so sorry that you're going through this. This is really heartbreaking. Um, I would say that if you haven't met with a fertility specialist, to definitely see one to just make sure that if there is anything that is modifiable, if there's anything that we could help to fix or to change to improve your chances of a live birth, we should definitely look towards doing that. Um, success really depends on your age as well. And so, without knowing your specific circumstance, I would say that your best bet is to go ahead and see a fertility specialist. Typically, we start to investigate after 2 losses, and so I think it's a lot, and there ought to be something that we should do for you. Just to help you to get to your goals of having a live birth. I'm really sorry you're going through that. Um, is it harder to carry to full term if I've had multiple losses? It depends on the cause of the loss. There are just so many things that can cause pregnancy loss. And I would say it depends also on your age and if there is anything genetic going on, if there is anything that we could repair, like if there is a polyp in your uterine cavity or a fibroid or something. It's not necessarily harder to carry to full term. It just depends on what the underlying issue is. And I would definitely recommend that if you've had more than 2 losses, it's time to go and see a fertility specialist. Thank you for that question. Um, what are good vitamins to take to prepare your body for pregnancy? So I did address that previously. And so you want to make sure that you're getting at least the recommended daily allowance for folic acid or folate. You also want to make sure that you're getting vitamin D. You also want to make sure that some of the vitamins have very high levels of, say, vitamin A that's not necessarily safe. So you want to make sure that whatever vitamin that you're taking that is specifically designed for pregnancy. I strongly recommend the brand Theralogics. Now I don't have any shares in the company, as I said before. It's just that this particular brand, they do go through the rigors of ensuring that what is on the label is what you're receiving because it's third party tested. Thank you for your question. Um, what are the first steps for a couple going through this process for the first time? I think the hardest decision is actually going to see the fertility specialist. Um, that's the hardest part. I think once you make that decision, coming in, definitely, we will take a history, conduct a physical examination, and then recommend some investigations. And so if you're over 35, if you're under 35 and you and your partner don't have anything that would prevent you from getting pregnant, y- a year is a reasonable time to try. Um, if you're 35 to 40, then I would say definitely 6 months is reasonable. But if you're over, sorry, yes, if you're over 40, you should just go right away or within 3 months, definitely, of trying to conceive. Um, you could also prepare yourself just getting some information online. It's difficult out there just because of so much information, but you could come in and just kind of have more pointed questions based on your own medical history, as well as doing the relevant steps of just trying to optimize your body for pregnancy. I will pause here to say this. Um, if you're struggling with your weight for whatever reason and you're trying to get healthy, if you're approaching 40, I strongly urge you to come in earlier than trying to get yourself optimized weight-wise or BMI-wise before you see a fertility specialist. At some point, fertility is going to become more urgent than, say, necessarily having a normal BMI. I hope that was a helpful answer to your question. Um, is it normal to be diagnosed with PCOS and randomly your doctor doesn't see any signs of it? That's a really good question. So, um, when we think about patients with PCOS, we're probably used to seeing patients who have a little bit more on the BMI side, as well as those who may necessarily have, facial hair that they pluck, wax, or shave, or those who may have acne. Um, there are some PCOS patients who fly under the radar, and that's because they don't look like that classic description of PCOS. So they may be a little bit more lean. They may be athletes, so they're used to not necessarily having regular cycles. And so, if you're concerned about a diagnosis of PCOS, um, we would see the patients and diagnose them more, perhaps because they come into us for fertility. But it's important to know that PCOS can cause other metabolic changes in your life and affect reproductive outcomes. So, for instance, patients are at risk of having diabetes or prediabetes, hypertension, cholesterol issues, as well as the irregular cycles predispose patients to having endometrial polyps, which sometimes could take on a more sinister appearance on pathology, and some patients may actually need treatment for endometrial hyperplasia, or it could actually get into something worse. So, if you're concerned about PCOS and you're not getting the answer that you desire from your doctor, it's always reasonable to seek a second opinion and just get that squared away for your own health. Thank you for your question. Is the gummy or the tablet version of a prenatal different, and which one is more effective? Oh, I love gummies. totally understand that. The gummies are definitely yummy. So, how they make the gummies, it's perhaps made similarly to candy, and then they put the vitamins on the top of it. And gummies in general don't have iron. They definitely don't have calcium in them. So, if you were to pick up the gummy version and the tablet version of the same brand, for instance, you're gonna see that you're probably getting the folates and maybe some vitamin C and so on, but definitely it's going to be deficient in iron and a lot of the other vitamins. Having said that, though, the iron content for some patients can be really harsh on their stomachs, and so especially early in pregnancy when there is nausea, um, the iron component could actually irritate that or make that worse. And so, um, I would recommend a tablet version. However, some people have difficulty swallowing the pill or just having irritation from whatever reason. It's better to take the gummy if you cannot tolerate the tablet, but I would recommend the tablet. If I hope that answered your question. All right. Is it normal to be 8 days post frozen embryo transfer with a negative urine test? I'm losing hope. Oh, this one's tough. Usually we test, after about day 9 to day 12, and we test with a blood draw or the serum pregnancy hormone. And the reason for that is in order for you to detect the level in the urine, it first has to get to that point where it's detectable on the urine test. So many of the urine tests these days are very sensitive. They could detect really low ACG levels. But I would say it's critical to stick to the timeline that was given to you by your provider and come in for a blood draw so that we could assess the actual hormone level and just make sure that it's rising normally, as well as it would be more confirmatory with a blood test. Um, I really wish you all the best with your frozen embryo transfer, and I hope you get the baby that you've been planning for. Thank you for your question. Next question is, are there any over-the-counter supplements that are actually useful, specifically for an overabundance of follicles? Over-the-counter supplements for overabundance of follicles. Trying to understand if the person has PCOS or if they want to improve their follicle number. Um, so let me answer it in that capacity. So there are certain things that you could help to boost your egg quality. Um, so as I said, any of the antioxidants specifically formulated for fertility, you want to stay away from anything that's not going to be safe in pregnancy. You could consider coenzyme Q10, especially if you're over 35, because it does give the eggs a boost and it will help with natural fertility. If you do have PCOS and you have an overabundance of follicles, you could consider adding in some myo-inositol to help with that. And that's all of these are over the counter and they could help with egg quality and or follicles. All right, thank you for your question. Let's see. Um, there are lots of questions on here on supplements, so I hope I'm answering the question. Should you use an ice pack or a heat pack for low dose HCG and follistin? Do they have to be refrigerated or while you're traveling or if you're away from home? Do they get do they get injected cold or should you warm them up or leave them up for a certain time? So I wouldn't put a heat pack on the medication. they're effective within a certain temperature range. Whichever one you're taking, I would say follow the manufacturer's guidelines. And I wouldn't necessarily heat them up, but it's okay to bring them to room temperature or body temperature. So what some people will do is, especially if it's the one like a low dose ACG that you pull up in an individual syringe, then you could just hold it in your palm until it gets, acclimatized to a comfortable temperature, and then you could inject it at that time. But I wouldn't necessarily apply a heat pack to the container. Thank you for your question. Um, Are there lifestyle changes that are specifically helpful for general fertility? For example, cutting out alcohol completely. I would say cutting out alcohol completely would be a reasonable thing to do. There's no amount of alcohol that is safe in pregnancy, and so for women, the maximum recommended dose is 12 or 12.5 milligrams, which is about 5 ounces of wine, or 1.5 ounce of more of those stronger alcoholic beverages. And so most people, when they're trying, they would just, cut out the alcohol completely or significantly reduce it to that amount during during their trying, and then, cut it out during the luteal phase or with a positive pregnancy test. What is the estimated cost of IVF for an IVF cycle at Boston IVF? So it's going to be dependent on many things. It's going to be dependent on what IVF are you doing? Are you freezing eggs? Are you creating embryos? Do you want to do a transfer? Are you adding in genetic testing? Um, so are you going to be doing intracytoplasmic sperm injection for male factor infertility? So I think it would be reasonable to reach out to or actual billing departments or just call the office. And if you're unsure about what treatment you need, it's important to probably meet with a provider and help to figure that out, so that you have an appropriate price range in mind. One moment. Drink water instead. Um, at what age would IVF not be recommended because of too low chances? I think it depends. So if you're approaching 40, you should definitely reach out expeditiously for a fertility consultation. So at Boston IVF, we have not been able to, it's very difficult to get somebody pregnant using their own eggs after the age of 45 with of the age of the person with the eggs. And so usually at that point is when we would recommend moving on to a donor egg IVF cycle. However, if you've had embryos frozen, or if you're the person with a sperm and you're older than 45, those are all things that we could work with. And so, if you're also open to doing a donor egg cycle, things like that, I would say reach out to your provider so we could individualize the plan that is going to be right for you. During an egg retrieval, a lot of eggs were retrieved, but only two made it to blastocyst. What reason could cause a low blastocyst count? Okay, yes, I know it's tough. You go through everything, you do everything right, and you get 30 eggs. And so it's important to look at the percentages. Was it that there was a higher amount of immature eggs? Was it that the eggs did not fertilize as expected? Or was it that they fertilized and then there was a drop off with creating the blastocysts? Or did you create blastocysts that were of lower quality and only two high quality blastocysts were available? So these are all things to look at. I'll start with, if you had a higher proportion of immature eggs, only the mature eggs are capable of receiving the sperm and being fertilized. And so that's something to look at and to consider if perhaps maybe either changing the stimulation process or doing other things to ensure a higher number of mature eggs. If it was due to a fertilization problem, then speak with your doctor about next steps. You may require something else, such as ICSI, to help to improve fertilization, as well as if it was just due to you had normal fertilization and then the embryos just didn't develop. Then there are multiple factors for that, which would be specific to your diagnosis and the actual outcome. And so I think that's gonna be for a discussion with you and your provider as to what you could do next time. However, I say this, if you have two embryos, maybe you're just efficient at creating good, high quality embryos, and maybe these embryos will lead to a live birth. And so, depending on your desired family size, if the embryos are normal or not, um, your age at which the embryos were created as the person who has the eggs, those are all things that could result in a live birth. And I say this that, so for some people having excess embryos, it can create a whole layer of stress also because then they have to figure out what to do next with the embryos when they're completed their family. And so I would say just reach out to your provider and decide what would be the next best steps for you. What can I take to get a period every month? Depending on your actual diagnosis, there are so many things that could cause you to not get a period every month. And so there isn't one thing that could make you have a period every month. And so, again, this is something that's just going to require an evaluation and to identify what's causing you to not get a period every month so that we could address that and treat it appropriately. How much vitamin D and folic acid should we look for in a prenatal vitamin? This is a good question. So, the American College of Obstetricians and Gynecologists recommend up to 2,000 international units of vitamin D, and that looks like 50 micrograms in a pre in a supplement. Um, with respect to the folic acid, they do recommend 400 micrograms. And so, you could go up to 800 micrograms depending if you've hadn't had any issues with, a baby that showed that you required higher doses of folic acid in the past, and so you should look for at least that in a prenatal vitamin. Thank you for your question. What if you've had 5 IUIs? Could you try IVF? Excuse me. It depends on your age and your actual diagnosis. I would say this, IVF will definitely get you pregnant faster. I think IVF will definitely get you pregnant faster, but IVF is not necessarily, benign. You have to do multiple visits. Sorry, I need a second. Sorry, guys. Every time I'm doing a Facebook Live, I'm cold. Okay, back to the question. Thank you for your patience. So it's going to be dependent on your actual diagnosis and your AMH and how you're responding to treatment. At some point, your success with IUI could actually equal what it would be with IVF. And so this would be a very personalized conversation to have with your provider if you're at that stage. I see that you're over 40. And so perhaps if you wanted to do IVF sooner would be better than later, but I don't have the full details of your individual condition. And so it's gonna be a discussion with your provider as to what will be superior and result in a higher birth rate for you. Thank you for your question. At what age can eggs not be used for IVF? At Boston IVF, at the age of 45, that's the age at which we don't use the woman's eggs for IVF anymore, and we do recommend moving on to donor egg. Is there anything you could do to increase egg quality? So, your success with IVF is going to be linked to the age of the female, the person with the eggs. So let's think about eggs. There are two components to it. There's quantity, which is what you have, or the egg reserve, and there's quality. So egg quality can be affected by certain things such as lifestyle, as well as have you ever had chemotherapy or radiation therapy? Do you smoke? And so if you're a smoker, if you consume excessive amounts of alcohol, if you eat a very refined diet, um, as in those low in antioxidants, you may want to reconsider and cut out the smoking, cut out the alcohol or decrease it significantly and eat a more healthy diet that's rich in antioxidants. Other things that you could add in include coenzyme Q10. I do recommend a dose up to 600 milligrams daily, depending on your egg reserve and your age. And you could also find this through Theralogics on their website. They do have one that I particularly recommend as being superior to several of them that are on the market. And you could try those to help to improve fertility. How much time has to pass between procedures if you've had a failed IUI? So if you did an IUI and you got a negative pregnancy test, thank you for your question. You could go straight into another one the following month. You don't necessarily have to wait. However, if you had a positive result, and then it ended unfortunately in a miscarriage or a loss, we do recommend waiting until all of that has resolved, making sure that your lining is and healthy. So your doctor may recommend doing a saline infusion sonogram or some other method to evaluate your uterine cavity and then moving on at that point. Thank you for your question. Are there any real fertility superfoods that are good to add to diets to increase fertility? Um, I would, it's pretty much the same. You want to stick with anything that's gonna be high in antioxidants, so nutrient-dense food, that food that have fiber, low refined carbohydrates. Um, the Mediterranean diet is good. I hope that answered your question. I had my first period at age 10. Does that mean my period may end earlier, say like in my early 40s? That's a good question. So not necessarily. Some people do have their cycle start earlier. The best way to think about it, you could just look in your family and see perhaps what age did your mom go through menopause and see. That's usually a very good predictor of if your cycles would end earlier, or if you just go to menopause. The natural age of menopause in the United States is 51. Um, and so if everybody else in your family went through menopause that's around that age, you're probably okay, provided that you need to have anything else medically going on. If you're a smoker, though, smoking does age the ovaries, and we find that patients who are smokers sometimes their eggs will have lower quality sooner, and they can go through menopause earlier. And so it doesn't necessarily mean that because you had an early first period that you'll go through menopause earlier. Thank you for your question. I got a miscarriage 3 years ago, and since then I never got pregnant again, and they can't find anything wrong with me. What are you thinking about that? I'm very sorry for your loss. Um, it's really hard to lose a pregnancy and then be struggling with infertility. So I would say if you've gone to the doctors and they can't find anything wrong and they've diagnosed you with unexplained infertility, it's very important to go along with their recommendations. There are many reasons for miscarriages, and one of the things that we consider, particularly in patients who have had a DNC or a surgical procedure to help to complete the pregnancy loss, is that there could be scarring inside the uterine cavity. And as fertility specialists, we're trained to evaluate the endometrial cavity with other tests other than just the plain ultrasound. So, for instance, we may do something called a saline infusion sonogram, which instills a small amount of saline into the uterine cavity so that we could separate the walls of the lining and we could have a better evaluation to see if there's any scar tissue on the inside. So I would definitely start there if you haven't seen a fertility specialist. My friend who's lost that baby 3 years ago, I strongly recommend that you reach out so that we could figure out what's causing this infertility. Thank you for your question. I had my first miscarriage in February. Is there any way to prevent it from happening again and for going full term? I'm so sorry that you had a loss. Um, Miscarriages are difficult. Unfortunately, human reproduction is very efficient, and there are so many things that contribute to having a healthy baby and a live birth. And sometimes miscarriage is nature's really cruel way of dealing with something that would have ended up with a loss later on. But sometimes it could be due to something else that's underlying, something that is correctable or modifiable. And so, in general, excuse me, um, for the most part, we don't necessarily do a complete pregnancy loss evaluation with one miscarriage. However, depending on when you have the loss, it may require further testing and evaluation. And so, I would say reach out to your provider. It's very normal to feel nervous and anxious. And if you can get like a really good support group or good social support going to help you through this, um, that would be very useful. It's very interesting to know how many people actually go through miscarriages, but it sometimes it's taboo and people don't feel comfortable talking about it. And excuse me, it's more common than you think. And I just want to reassure you that you're not alone going through your pregnancy loss. And if there's any way that you could find some support to just help you to go through this, I think that would be very helpful as well. Next question is, what what advice would you have for somebody trying to conceive with endometriosis? Endometriosis is a tough one. Excuse me, endometriosis is a very tough one to deal with. So if you've been diagnosed with endometriosis and you have stage 3 or 4, so like you're going into that severe, moderate to severe endometriosis, at least stage 3 or more, your best bet to conceive is going to be with IVF. There's no ifs, ands, or buts about it. This is gonna be the way to go. If you have milder endometriosis or um could try with starting with some insemination with medication, so medicated insemination cycles. But the issue with endometriosis is that it's multiple factors at play here, and one of them is that chronic inflammation actually causes distortion in the tubes. Now, when an egg is released, it gets picked up by these organs called the fallopian tubes that are attached to the top end of the uterine cavity. And so endometriosis could actually cause scarring that could affect the ability of the tube to pick up the egg and for the egg or the embryo that are trying to get together inside the tube from traveling down into the uterine cavity. And it does put you at risk for either infertility or like an ectopic pregnancy. And so that would be my advice to you, that if you've been diagnosed with endometriosis, please immediately go to your fertility doctor so they could they could individualize a plan that is going to be best for you and optimize your success. The next question is, I'm a recovering anorexic and now at a healthy weight. And if I'm having normal periods for over a year, could I still possibly not ovulate, or does ovulation only occur during the menstrual cycle? Okay, so um, I want to congratulate you on going through recovering from anorexia. It's a very difficult thing to do, and congratulations. You should be very proud of yourself. You're at the point at which you're ovulating, and if you're having a period every year, every month, so and that's falling within that normal range of, between 21 to 35 days, that should indicate that you're ovulating. And you can confirm ovulation by doing an ovulation predictor kit. It works for most people to see if you're ovulating. Typically, ovulation should occur approximately 14 days before your period starts. So if you're going to use an app to track, the app will just kind of help you to identify your cycle length so that you should know, okay, maybe I should start testing with an ovulation predictor kit at around this time after my period starts. Having said that, there are so many things that go on into a pregnancy, and so it could be anything. It could be an issue with the fallopian tubes. It could be there is something going on inside the uterine cavity. It could also be something going on with the sperm. And so I know the natural tendency is to want to think that, well, it's my fault. I did this. It's something that I did in my past. I just want to encourage you to just um, just give yourself some grace to move forward because you have overcome something that's pretty significant. And if you've been trying and it's not happening, I'd recommend that you reach out to a fertility specialist just to get at least a basic evaluation performed so that we could get to the bottom of it. I hope I answered your question. Okay, I just had my embryo transfer 3 days ago. Can you explain what a grade 3 AA embryo means? And what are the chances that it will turn uh into a pregnancy? So, thank you for your question. A grade 3 AA embryo is a very good quality embryo. So when we look at embryos that are not tested, they're graded in terms of three things, and we call this the morphology. So the number corresponds to how developed the embryo is in terms of the stage of its development. So like a grade 3 embryo is what we call a full blastocyst. So the letters then correspond to the different cell types that are in the embryo. So there are two cell types in the embryo. One cell type would form the inner cell mass that would go on to form the baby, and the other one would, they're called the trophectoderm cells that would go on to form the placenta. So AA would be the highest grade embryo um, possible. And a grade 3 is actually also pretty good. It would actually go through the rest of the processes, hopefully inside your uterine cavity. And if you're under the age of 35, that should also confer one of the highest success rates, because that's a point at which you would actually have a higher quality of oocyte, which would then lead to a higher quality embryo. So your chances should be at least about, in the 50% range. I hope that answered your question. Thank you. Can endometriosis go undiagnosed or missed? Absolutely. So, in patients who are diagnosed with unexplained infertility, meaning that they had normal egg reserve, they were ovulating every month, they did a tubal evaluation and their tubes were found to be normal or open, and the sperm parameters were within normal limits. We're finding out now that a subset of these patients actually have what we call silent endometriosis. And this is typically these patients would undergo IVF, and do multiple transfers and not get pregnant. And there's actually a test now that we could add on to an endometrial biopsy that could help us to find that biomarker or a certain test that would help us to figure out if you have silent endometriosis. For some patients, endometriosis could present as significant pelvic pain. So whether it's period pains or pain with intercourse or pain with going to the bathroom, those patients typically come in and present early because they're having those symptoms. There's a subset of patients with endometriosis who actually present with infertility, and those are the ones that it tends to be a little bit more dicey to diagnose because they don't have pain, they don't have anything else going on, just infertility. And I'm really happy that we have the technology now to help to diagnose these patients. And if you suspect that you have endometriosis and you fall into any one of those categories that I described earlier, raise it with your doctor. And so we could look into it and just help you figure out, do you have endometriosis or not? Thank you for your question. What causes cervical insufficiency? Um, it's a tough one. So some patients are just, it just happens. They haven't had anything that predisposed them to cervical insufficiency. Some people may have had a procedure on their cervix, so something surgical like a LEAP procedure or something that shortened the cervix could result in cervical insufficiency. And some people also have what we call like collagen vascular diseases or um, like those conditions that their collagen they're like really stretchy. I don't know if I'm explaining it right, but um essentially those patients could also have weakness in their collagen and have losses too. So um I hope you didn't have a loss. If you did, definitely reach out to your provider. If you had a loss in your second trimester, there are things that they could do, such as serial ultrasounds, and recommend cervical cerclages or vaginal progesterone, depending on your actual individual diagnosis or history. Thank you. Um, thank you for your question. Let's see, can frozen eggs cause more risk of miscarriages? So our data doesn't support that frozen eggs cause more miscarriage risk. Um, it I would say that it's gonna depend on the age of the egg source, and so eggs that are younger would confer a greater chance of success than eggs that are older. And by older, I don't mean the length of time that it was in the cryo tank or the freezer, but in terms of the age of the person at the time at which the eggs were harvested. And so the freezing in and of itself doesn't necessarily predispose to miscarriage, provided that you get a normal embryo. Thank you for your question. Um, let's see. How common is it to end up with twins from conceiving through IVF? Um, okay, thank you for your question. So if we put in one embryo, there's about a 1.5 to 2% chance that this one single embryo could split into twins. However, if you put in two embryos, then that risk is going to be dependent on the age at which the embryos were created, um, as well as the individual embryos themselves. So typically, when we put in two embryos, we would put in two embryos if you're older than say 37 and the embryos were untested, or if you've had tested embryos, perhaps you've had multiple single embryo transfers in the past and they just didn't result in a pregnancy. So I would say it just depends on all of those factors, depending on the embryo itself as well as your individual history. So let me go back. Sorry, I didn't realize there was something else. This person wants twins. Um, sorry, the question went away, but typically your chance of a live birth is going to depend on the age that you created the egg source created the embryos. And so it's not unheard of to have twins at your age over 40. Again, it just depends on the quality of the embryo itself. Well, I wish you have a healthy pregnancy and live birth, of course. So, um, thank you for your question. What is the cost difference between IVF and IUI? Also, what's the difference between them? So IUI stands for intrauterine insemination, and typically when we do this, we could do it unmedicated, medicated, monitored, or unmonitored. So there are several things that go into it. The short answer is for an intrauterine insemination, there's an egg that's going to be released, and the fallopian tube should be open. And what we're doing is we're injecting the sperm that has been previously prepared to concentrate the good, fast swimming sperm into a very small volume, and we put that directly into the uterine cavity, which is as close to the egg that it could get without doing IVF. I described that we could do it with medications to help to improve how many eggs are being brought forward, as well as if we're monitoring you with blood work or not, or if you're just doing a urinary predictor kit for ovulation and then coming for an insemination. IVF is a whole lot more involved. So what we're doing with IVF is we're recruiting all the eggs that are available for the cycle. It's pretty strong medicine, and we have to monitor very closely. So typically, patients come in, I would say, plan for maybe 6 visits or so. There's a baseline visit, there's a first monitoring visit, there are other visits to check the hormone levels with blood work and measuring with ultrasound, as well as that retrieval visit to harvest the eggs. And so a lot more involved of a process, more close monitoring, more medications, stronger medications, etc. Thank you for your question. Are donor eggs available? Absolutely. So there are different ways that we could get donor eggs. Um, we could do like a fresh donor egg cycle, or you could purchase frozen eggs from an egg bank. And the individual choices may vary depending on your needs, as well as the location that you're living in, as well as the desired eggs, the quality of not the quality in terms of the the characteristics of the egg source that you want. And so yes, there are multiple egg banks online that you could go and take a look and just see, and then you could sign up depending on what your individual needs are. I would not purchase any eggs without checking with a fertility specialist, just because we do genetic testing just to make sure it will be compatible with the sperm source, and that's definitely something to look into as well. So, yes, there are egg banks out there. I have to undergo surgery to remove fibroids and possibly my fallopian tube. So sorry, that question just went away from me. If it's not open to increase my IVF success, how long can I delay my surgery for? I'm already 39. Can I have the surgery 6 months from now without having to go through a series of tests again? It depends. If you have embryos um, already, if you don't have embryos, um, I would say I would recommend that you go along with whatever your doctor is telling you to do. Just after you get to 39, fertility falls off very rapidly, and so what you don't want is to kind of lose your precious resource of time on the front end and kind of find yourself in a difficult situation later. So um yeah, I would say go with whatever your doctor is telling you to do. I wouldn't wait for too long to proceed at 39. What's better for egg quality, CoQ10 or prenatal? The prenatal is going to optimize you for pregnancy, so folic acid, vitamin D, things like that that you will need for the early stages of pregnancy. Particularly for folic acid, your body isn't able to hold on or to store it for a very long period of time, and so it's very important to take it every day. Coenzyme Q10 will definitely help you a little bit more with egg quality, and so it's totally fine to take them both together. Is AMH of 5.41 at age 39 good or bad? Um, so an AMH of 5.4 is a pretty robust number. At 39, when we think about the eggs, we're thinking about two things. We're thinking about quality and quantity. And quality refers to the proportion of eggs that are going to be normal and could lead to a healthy pregnancy. And so it's kind of a numbers game. If you have a little bit more eggs, you're hoping that a greater number of them would be normal just from a proportional perspective. And so I think you're going to be in a better position having a higher AMH to get some good quality eggs and have a possible live birth. How often do donor eggs work? Um, it's going to be dependent on multiple factors. I would say that most of the donors tend to be under the age of 30, and so your success rate from a donor egg should be about 50% or so. Having said that, you have to consider the sperm as well as the endometrial cavity, as well as if there's anything else that could interfere with a pregnancy, such as if there's fluid in the tube, things like that that could compromise fertility. So overall, your success rate should be about 50%. The recommended dose for coenzyme Q10, I'd recommend 600 milligrams daily for egg quality. Many women today are choosing to have children later in life. Do you think that with the advancements in medical treatments and technology, having children in your late 40s still carries a risk? So, whenever I see a patient who's over 40, there are several things that I do. One, I want to make sure she has a mammogram. If she's over 45, I definitely want to make sure she has a colonoscopy, an EKG, cholesterol screen, and I do refer her to a higher risk OBGYN just to even talk through some of the complications. So absolutely, your risk for diabetes is greater. Your risk for hypertension is higher. Risk of adverse outcomes related to preterm birth, etc., could be greater. And so, having said that, if the person is healthy and they're well informed and they have excellent prenatal care, it is possible to deliver a healthy pregnancy. But I would say, if you're if you're planning to delay fertility, just be adequately counseled so that you can make a very informed decision. And part of that would be to create the embryos or to at least freeze your eggs earlier so that you give yourself the best opportunity down the road. Thank you for your question. Um, are there ways to improve motility of sperm and testis samples? So the sperm and the testis samples, so the sperm has to undergo maturity outside of the testis in order to be motile. So typically the testis sample sperm, we know that it's not going to be motile and we're going to have to do a procedure called ICSI to inject the sperm. I would just focus on ensuring that you're being healthy to just get the sperm as healthy as possible, rather than focusing too much on the motility with the sperm that is extracted from the testes. Um, how do you know if you're ovulating? Good question. Um, and so you could try one of those ovulation predictor kits if you're one that you would test positive. Other things we could do for you, we could check to make sure that you have ovulated by checking your progesterone. Um, the progesterone classically would increase after you've ovulated. And so also the basal body temperature would increase after you've ovulated. So those things give you historical information. They're not necessarily going to be useful for the current cycle that you're in. And so if you want to know for sure if you're ovulating, the ovulation predictor kit is probably the better way to go. However, for some patients, as I said, it doesn't work necessarily. And so, if you find yourself in this position, like if you have polycystic ovary syndrome or something like that, where you don't ovulate consistently, you may want to consider doing a treatment with some ovulation inducing medications so that you could ovulate more consistently. I was diagnosed with PCOS and I've been trying to get pregnant ever since December 2024. Do you think PCOS should be the reason for my difficulties? It could be if you're not ovulating consistently, which is one of the issues that our PCOS patients face. However, if you do have PCOS, sometimes it's possible to have something going on inside your uterine cavity, like polyps, that could put you at risk for not getting an implantation or a pregnancy. And so there are so many other things. It could be a tubal factor. It is possible to have multiple pathologies or multiple diagnoses at the same time. And so it's very critical that you undergo a full fertility evaluation rather than attributing your infertility to PCOS. Um, how far in advance should you start to take supplements to prepare your body? I would say at least 3 months, definitely, for that folic acid to build up in your body. Um, does having a termination in your 20s affect your ability to have children in your late 30s or 40s? Um, It depends. If you had any scar tissue from the termination itself, so scar tissue inside the uterine cavity, that could go on undiagnosed for years, especially if it wasn't evaluated for with an appropriate uterine cavity evaluation. And so I would say that it's important to get that looked at. However, I don't recommend waiting till your late 40s, late 30s or 40s to attempt a pregnancy. Definitely, if you're at that stage where you can even look into it or perhaps bank some eggs or some embryos prior to getting into the 40s. Even with everything being perfect, the 20-year-old version of yourself compared to the 40-year-old version of yourself the 40-year-old version of yourself will have significantly lower chances of pregnancy and a live birth. And with the technology that we have available today, where we could freeze eggs and embryos, that's something that you could consider, especially if you're not in the situation to get pregnant right now, but so that you could preserve your fertility for later. This person saying that they had a tubal ligation, the best option to get pregnant. I strongly recommend IVF. Um, it depends on how you had your tubal ligation. For some people, if they're younger and they want multiple children, they may consider getting the tubes put back together. However, it depends on how old you are, what type of tubal ligation you had, and how much tube is residually placed there. And you would actually have to find a reproductive surgeon who is very skilled in putting tubes back together. That's not something that I do per se in Massachusetts because IVF is just, we do a fair amount of IVF here. We're pretty good at it. And so for patients who've had a tubal ligation, I just recommend going directly to IVF. Can a single woman do IVF? Absolutely, you can. I would say meet with one of the providers, and there are many sperm banks out there that we could refer you to after some testing and some counseling, and just making sure that we have everything in a row and appropriate for you. And we could absolutely do IVF and be a single parent by choice. Our autoimmune disorders considered and treated during fertility care and IVF. It's going to be very dependent on the autoimmune condition itself and how it would interfere with what we're doing and pregnancy. So, for instance, one of the commonest autoimmune conditions that we see is something called Hashimoto's thyroiditis, which is an autoimmune condition of the thyroid. Typically, for those patients, we want to watch and make sure that their thyroid hormones are within a certain target range, as well as with a positive pregnancy test, we go ahead and adjust the medications for the thyroid medication. And so we will work very closely with your medical endocrinologist and make sure that everything is optimized for you. I want to thank you for joining us tonight at Boston IVF for another